Good morning, everyone. I am Diptendu Bhattacharya, a drug resistance TB survivor and a patient advocate for survivors against TB. Today, I am presenting TB, the topic TB and COVID 19, ACTB's finding on the impact of COVID 19 pandemic on TB at India TB summits. Recently, I have been contracted with the COVID 19 and some 4 5 months back, and I had to deal with another deadly disease after I have gone through tuberculosis, and I found something astonishing which is not expected at all. The TB and COVID are similar kind of disease, yet one of them are getting much more hype and much more attention, but the older one, which is lingering with us for last 10,000 years and killing 1,200 Indians every day, are not getting that much of attention. Moreover, this kind of disease um, created a global pandemic also worsened the situation for the TB patients. So SATB has set up a virtual help desk in March 2020 to assist those patients who are suffering from TB and having trouble during this session. So based on the queries made by those patients, we have conducted a observational study to assess the impact of COVID-19 on TB services. Here I am presenting our findings in front of you. So our main objective was to identify the kind of challenges and services that patient and the communities have gone through and how they can be uh, addressed. And here also we are presenting with some recommendation. So we have done a prospective observational study of queries. These queries are classified into a general and some few other specific categories, and we have then comprehensively studied them, analyzed them, and presenting the findings from that observation. So we can classify those queries in four categories, in more or less speaking. The biggest one of those of that category was about treatment. The treatments are suffered a lot due to the lockdown. The stocks were empty at the beginning of the COVID-19, and where the stocks were available, the patient didn't have any mean to go and procure those medicine for themselves, especially those injectables. Uh, then related that resulted into some scare and fear among the patients. Those people are also troubled by the fact that both are similar kind of disease which can interact with each other, and what will be the impact towards their life. Moreover, a few patients missed the opportunity to get diagnosed early and got their tuberculosis worsen, which can be managed in earlier stages because of that lockdown. Moreover, last but not the least, the lockdown has taken up our economy into the downslide, which results into a more complicated situation that we find people are lying without any proper nutritional support, which is essential for tuberculosis. So here, our overall analysis about the situation was that there was a gap between diagnosis and the treatment, and also that results in the mental health challenges and other challenges which cannot be supported because of lack of patient support. And sometimes it is happening that patient is educated enough to support themselves in this kind of situation, but teacher education and literacy was virtually absent. Patients are facing difficulties, and even in October also, when we have concluded our study, even then, even though the lockdown was virtually over by then, uh, along with that, we have seen that there are stigma and gender discrimination and mental health issue is rising around COVID patients. So this is not a rocket science to understand that the same thing are faced by TB patients for years. So so these are the area which need to be addressed from the policy level and many other supportive level also too. The lockdown has shown us that how the situation is worse for both the cases if happened simultaneously. So here are a few recommendations of us. The first and foremost thing we can do is the prioritization of the case detection. Without detecting the cases, we cannot ensure that it will eradicate one day, and address the treatment challenge like stocking and the proper distribution and door-to-door service. Third, setting up a proper mental health and stigma support, yeah, in by increasing peer support where people can share their experience and being a strength for each other, and then uh, find a proper deployment of strategic communication which can educate the TB patients. For that we can take the help of biggest revolution of our decade, that is the uh, uh, internet, and create and initiate a telemedicine kind of feature which is greatly accessible to the TB patients. TB can we can also emphasize the community built up case where people can share each other's experience and get solace from that experience and guidance. And they also we are requesting the private health services to engage themselves in a larger scale, so that the whole the pressure should not be put on the public service. And strengthening the implementation of direct benefit transfer may help the help the challenges around nutrition. And last and but not the least, we must take care of the gender responsive care and solution, so that the gender discrimination around tuberculosis and stigma are not lingering within our society. So, in conclusion, we feel the need of involvement of support survivors and communities to eradicate this disease. We must develop a strength and strategy to work with both the TB and COVID simultaneously. Every crisis is an opportunity to improve, and this is our opportunity to improve our health and services. And while it is important to deal with COVID, we must ignore, we must not ignore TB because we cannot afford it. Thank you.